Artificial intelligence is a reality in IVIRMA Global. We use AI for many different aspects of our research, and basically we go from clinical decision making to embryo selection. In fact, the latest studies that we have done with Dr. Meseguer is using the embryo selection through AI and try to correlate with PGT-A, with invasive technologies, to understand the chromosome composition of the embryos. We have witnessed up to 90% accuracy between AI embryo selection and PGT-A. So this is going to be a reality sooner than later, that we will be probably replacing invasive technologies. Now, Dr. Meseguer may explain this much better.
Let's talk about artificial intelligence in the clinic. Artificial intelligence, for example, here in the lab, is going to help us, it's going to help the embryologists taking decisions like the embryo to be selected for the patient. We have several embryos, and in that type of decision, which is very important for the outcome of the cycle, the algorithm from artificial intelligence may help us to select the best one, or the embryo with more chances to be transferred, to have a baby, and maybe to be chromosomically augmented. But it's not only in the lab, it's also in the consultation. Artificial intelligence may help the doctors taking important decisions. For example, the dose of stimulation that should be used, the type of drug that is going to use, complementary to other type of evaluation. For example, with ultrasonography, it may help us to know which is the day in which the tubing should be done. And if we go to the embryo transfer, it may help also the doctor to know exactly the location or the place in which the embryo should be delivered. But what about the patient? The algorithm and artificial intelligence may take the role of the doctor and may help the patient to know which are the expectancies of the cycle, how many oocytes are going to be recovered, or which are the chances to have a baby with an IVF cycle.
At IVIRMA, having a baby is not the only concept. We have to go beyond that and try to make the journey for our patients significantly easier. We're building the future of reproductive medicine, and so how do we do that? There are different ways. One of them is basically automating the labs. Lab automation is going to be one of the main concepts that is going to change the way we practice in the IVF labs, making the processes much more efficient and more secure. Also, we will try to accommodate things for the patient so they have a better life with different technologies that are going to be implemented sooner than later. For example, trying to do ultrasound of the ovaries and folliculometries at home, so the patient can use a device that she can self-scan the ovaries, send the images to the web, and the doctor can analyze the results online. We will be able to probably analyze hormones in saliva or without needles, trying to avoid the inconveniences of having blood extractions. Probably analyzing results online and having direct access to the results of the lab and to the images of the embryo as it's being developed. We can think about many other points of care that are going to be crucial to facilitate a busy life of our patients at work, or a busy life with the previous family and the previous kids, so that we can minimize the time spent at the clinic. In fact, the concept is to bring the clinic to the patient rather than bringing the patient to us. We can even think about sperm analysis being done at home. This is something that is being developed already, and try to send the sample to a lab but without visiting the lab. So when the couple comes to the clinic, they already have quite a lot of information regarding the ovarian reserve, maybe an image of the ovaries, maybe the sperm analysis results, and from there we can move slowly but farther and try to make the life of our patients significantly easier.